Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we're talking about how to prevent cavity formation, or in other words, how to prevent dental caries from taking place. Cavities are holes that are seen in your teeth, as you can see in the picture. They can happen when decay takes place in the tooth enamel. The decay can collect plaque. What is plaque? Plaque is a type of bacteria. Plaque is sticky and can cause the enamel to crack, which creates eventually a cavity, as you can see in the picture. Now let me explain to you in details how the dental caries develops. First of all, you'll have a layer that is plaque. This plaque, it is not same as calculus. Plaque is removable by you, by yourself, by the patient himself, whereas calculus cannot be removed only by the dentist. So that is the first thing that happens. When you eat something like full with sugars, with time, the plaque will start to develop all over your teeth. Now, the question that comes into your mind, can you see plaque? No, you cannot detect plaque. Plaque can be detected under an ultraviolet light. That is, by the dentist himself can detect the areas of plaque that you have. So that is number one. We have in the picture tooth with the plaque. Number two, we have now with the plaque with time it will be transferred into calculus. Calculus is a hardened tooth structure. It is a hardened caries. Now, in this stage, you cannot remove the calculus. So here you have a decay in the enamel. When you have caries that is limited to the enamel only, we have different types, and I will show you a picture in a couple of seconds, in which there are types where you can remove the caries itself because still it is not yet in the demineralization stage. Afterward, the decay, once if left untreated in the enamel, it will progress deeper down, going into the second layer, which is the dentine. Afterward, left untreated, it will go and hit your pulp, and at the end, once it reaches the pulp, because the pulp is the nerve supply for the tooth, once it reaches the pulp, you will start feeling pain. Whereas once you have caries in the dentine, what you will feel that you will have like a severe short pain. Like when I bite on something, I have pain. Or in other words, when I drink something cold, I have a severe pain that is short duration, that is lasting for 9 seconds only, in comparison with the pain that is in the pulp, that is severe lingering pain. You will have pain of longer duration. This is how you can differentiate the caries if they are in the dentine or in the pulp without an x-ray examination. So here in the picture, you can see this type of caries is referred to as the incipient caries. What do I mean by incipient caries? Incipient caries, when you see a chalky white enamel, okay, when you see something white that is covering your tooth, this is referred to as the incipient caries. Now, at this stage, once you have incipient caries, remineralization is possible without intervention from the dentist, which means that you can get rid of the incipient caries without needing to go to the dentist and wasting your money. So this is the incipient tooth caries, which you can remove by yourself by proper brushing of your teeth and flossing, and gradually it will go by itself. So once you are in this stage, you need to take care of your teeth before it reaches the second stage, which is demineralization, black or brown spots that will be seen on your teeth. As you can see, this is the second type of caries that you need to know about, referred to as the pit and fissure caries. For a patient who left his teeth neglected with time, he ended up having pit and fissure caries. And here, remineralization is not possible because this is a stage of demineralization. Now here you need to go to a dentist, and the dentist, he will drill inside the tooth in order to remove the caries. You know, the most common type of caries that are seen in the adults and the children is the pit and fissure caries, because biting or chewing of food takes place in the posterior, which is in the molars. So therefore, pit and fissure caries is the most common type of caries that are seen. Now let's talk about the ways for prevention of the dental caries from taking place. Or in other words, if you have incipient caries and you don't want it to progress into demineralization, into dental caries, there are 5 different ways which I will speak about. Please do follow. Number 1, you need to eat a balanced diet that includes plenty of fruits and vegetables. Why is that? Because the fruits and vegetables, they contain an antioxidants. Antioxidants, they will boost your immune system, and they will also contribute to strengthen your teeth rather than weaken the teeth and causing demineralization at the end. Number 2, you need to brush regularly, twice per day, after breakfast and before you sleep. Not only will help this remove the plaque and food particles from your teeth, but it will also help to remove any bacteria that may be contributing to the tooth decay or caries. Number 3, you need to use a fluoridated toothpaste or a toothpaste that contains fluoride. Why is that? Because the fluoride is important for preventing cavities, because it helps to strengthen the enamel on your teeth. And this type of toothpaste that you can see in the picture, Sensodyne toothpaste, is the one that all dentists and me myself, I recommend you to use. Last but not least, avoid sugary drinks, snacks, and candy, because all these, of course, they will contribute to dental caries. Lastly, one of the best ways to prevent cavities from taking place is to use water flosser. The water flosser, it has the ability to remove any plaque. 99% of the plaque will be removed from your teeth by using water flosser. So I recommend all of you to buy a water flosser, even though it is quite expensive, but remember that water flosser will save your teeth from dental caries, from extraction, from losing your teeth with time, all these.